All right, everyone. Welcome to another episode of Hi, I'm Doctor. And this week we have the Kyle Stanley. I'm just super pumped to meet you again in person. I just see you everywhere these days. You're all over Instagram. You were just in New York at the MegaGen symposium that a bunch of my buddies were at. And I felt kind of like, man, I wish I was there to hang out with you. But tell us about you, Kyle, and what have you been up to lately?
Yeah, so I'm a dentist from Southern California. My brother's a dentist, my dad's a dentist. I studied here in Southern California and then went to Brazil and did my implant specialty and implant residency. So it was kind of an interesting path that I've had. I was able to get educated in Germany and in Brazil and in the US. So I have a little bit of a comprehensive global vision. I've been involved with different aspects of dentistry from research to, I taught at a university for 9 years. I have a private practice in Beverly Hills. I started an artificial intelligence company called Pearl. And then I've been able to really take a lot of my experience and help doctors around the world, whether it's through education or whether it's through mental health or AI. So it's been really an interesting and not non-typical career for a dentist.
That's what this podcast is about. I think you're so cool, and I think you're so you stand apart from the pack so much because at least I see you as the dental mental health guru. And as someone who's like a self declared mental health advocate, which I mean everyone is now, right? It's like just a bumper sticker you put on, and it's hard to actually translate that into meaning and tangible things. How did you get involved in that space?
Yeah, so it was February of 2018 that I came home. It was late at night. It was, kind of wet outside. I could smell the asphalt. And I went to knock on the door because my wife had the door dead bolted. And she opened the door and I said, or she said, "Welcome home." And I said, "I can't do this anymore." And she said, "What can't you do anymore?" I probably should have said I can't do dentistry anymore, but because kids, family, marriage. And she said, "What do you mean?" And I said, "Dentistry. I can't do this anymore. It's too hard. It's too stressful. It's not worth the money. I just can't do this anymore." And that was my turning point. That was the time when I had to put my own oxygen mask on first. I travel a lot for speaking, and they talk about you're going down, you're about to crash, put your own oxygen mask on first. And it usually doesn't make sense for us. We want to take care of our kids or our parents or our neighbors or, our spouses. But sometimes us dentists give, and we never think about ourselves. And I was suffering from anxiety. I was depressed. I was ready to quit. And from the outside, I had everything that everybody, every young dentist wanted. I had the celebrity practice in Beverly Hills. I had amazing mentors. I was pretty good clinically. I had been writing research. I was, speaking at the top podiums around the world, and I was miserable. And so I made that decision that I had to go on this journey. I had to put myself first. And I started studying, I'm a researcher. So I went right to PubMed and was just like, why do I feel like this? And just started reading research article after research article. And I got involved with positive psychology and daily habits and how this affects your mental health. And so I went on this journey. And then I remember I was outside one day in the middle of the day, which sounds kind of crazy to most dentists, right? Out of the office. And the sun was coming down on me. I live in Southern California. So the sun was coming down on me, and I just felt this warmth. And I felt like I'm finally getting better. And something had changed in me. I had gone through this big change in my life. And I said, I need to start talking about this more. And so I was talking about it more, really just to help myself, because I needed someone to talk about it with. And I happened to have this platform that, my speaking engagements had created for me. I was speaking about 40 times a year. So I would talk for 6 hours about implants or smile design or guided surgery. And then for the last 10 minutes, I just bring up mental health. And afterwards, no one would come up to me and say "Oh, wow, that guided surgery case you did was awesome," or "I love the little mamelons on that anterior tooth." No, they said "Thanks so much for talking about mental health. I'm going through it. my husband, my wife, my kids, my partner, my whoever, and nobody talks about this. And so I started doing that more and more and more. And then people started coming up to me and being like, hey, do you have like a support group, or do you have like a course, or do you have something for dentists? And I was like, no, not really. I just did it for myself. And then COVID came and I said, now's the time. Yeah. And so I created this course, and to date, we've had hundreds of doctors go through it from almost 50 countries. And it's been just so humbling. And it's really been one of the most rewarding things that I've done in my career, is to give back to our colleagues and really make a change.
I totally hear exactly what you're saying. I've been a dentist for, I guess, almost 15 years now. And I feel like every dentist has had those same moments. You come home and you're just drained, and you question whether, you made the right choice early in your life to go down this path, because no one prepared us for how rough dentistry can actually be. In your opinion, what part of dentistry is the most difficult? Like what is it that kept you up at night, or what is it that made you come home feeling deflated every day?
Yeah, so I have something called the 16 trigger map of dentistry, and this is all of the triggers that I've identified and that some of the participants in my course have identified. And one of the big ones is working in an environment of fear. This is something that nobody talks about. Every single day we work in an environment of fear. Our patients are fearful of being there. Even if they like us, they're fearful of being there. It causes them to say rude things. It causes them to come late or cancel or move around when we're giving injections. And what they don't talk about is how that affects the dentist.
Yeah.
We talk about, how does it affect the patient? How does the patient feel? How's their blood pressure? And which we should worry about for sure. But no one talks about how it made me feel. And what consumers, or non-dentists don't realize is how uncomfortable it is to work on someone that's scared, because we're waiting for them at every moment to jump. So if we could just go through and, prep that tooth or place that implant, it would be very smooth. But we're like waiting at every point for them, and it riddles you with anxiety. And so that's probably one of the biggest ones. I think another one is revisions. And when I say revisions, you may be saying, what the hell is a revision, right? That's a medical term. So if I get in a car accident and I break my ankle in 30 pieces, I go get a surgery and I still limp afterwards. I go back to my doctor and I say, hey, I'm still limping. And they go, you need a revision surgery. And guess what? You pay for it again. We don't sue the doctor, right? But in dentistry, if your bite limps, or if your aesthetics limp, or if the contact limps, or something like this, first of all, patients are thinking, sue the dentist. They did something wrong. And they come back and expect to not pay for anything.
Absolutely. And it's just so difficult to get your mind around that.
It's so different. And so I like to talk about how we can prepare patients better, give them real, true expectations. And that includes time, pain, fees. What I found is the more you're upfront with patients, the more they accept these complications. In dentistry, we call them failures, right? In medicine, they call them revisions. And so I'm trying to change this wording around, right? This is a revision surgery. You're going to have to pay for it again.
Really? It's just so different than what we're used to, because it's almost as if we place these warranties upon ourselves that we offer the patient without even verbalizing it.
That's right.
And it's almost like patient's expectation of us, because if something doesn't work, it's automatically our fault.
Mm-hmm.
And we're dealing with diabetics. We're dealing with people that maybe haven't had the best oral hygiene for the last 60 years, and now are expected to wrap that all up into this one surgery and fix it. And it's just not realistic. And so I completely hear what you're saying.
Yeah, those are some of the big ones. But like I said, there's 16 different triggers that I have been able to identify.
From because I'm really interested with what you're doing, like on the dentist, again, you said put your own oxygen mask on first. Me and a couple of buddies, we just finished our last exam today of third year oral surgery. So it was not a fun time, but nonetheless, we started this thing called the Accountability Project, where, peer to peer, we just finished a month long of exams. We were keeping each other accountable, and we would make sure that, people had accountability buddies that they could, remain accountable to in order to keep their good habits going. And, just like we started this conversation off by saying, everyone wants to be a mental health advocate. And in the same, way, everyone wants to be, focusing on their mental health. And one thing that I realized that I didn't at the outset was, yeah, you can put all these tools in front of people, but how do you make people want to help themselves? Because that's like more than 50% of the battle is, how do I get you to help yourself? And, you have the course, that's a great resource. How do you get dentists to actually sign up and want to help themselves?
Yeah, it's a really interesting question. Sometimes you almost have to catch the dentist that doesn't know they need it. So for example, when I was just at AACD last week, and someone had asked me to speak, and they said, do you want to speak about mental health the whole day? And I said, I find it better when you actually put in a clinical topic at first, and the mental health is at the end, because you'll get the people that just come for the clinical topic. And then they see the mental health topic and they go, oh shit, like I didn't know I needed that. And I really needed that. Us dentists are so wired to just think, I have a problem, clinical solution. That's it. It's like problem, take more courses. Problem, learn how to do implants. Problem, learn how to do third molars. Problem, something like this. So it's always clinical. And us dentists, we're so practical in what we do. We're such practical human beings that mental health almost seems a little too like hippie woo-woo out there. And so what I wanted to do was bring that practical PubMed research-backed ideology to it, because there's so much research behind it. It's not bullshit. It's not like, do yoga and, something like this. It's even yoga has great research behind it. And so I try to bring this like research-backed view that I know dentists will appreciate to the topic, and they do it. The other thing is too, you try to have dentists not only think about themselves, is think about how they can be there for others. Like for me, when I was going through my really difficult time, I wasn't there for myself, but also because I wasn't taking care of myself, I couldn't be there for my wife. I couldn't be there for my kids. I gave everything to my team members and to my patients and to my profession. So when I got home, I had nothing left for the important people. And that, I still have guilt about that. I have to really like give myself grace about family meetings that I missed, and, soccer games and dinners and things, because I was doing a wax up or meeting with another doctor. So you have to think about, if you are a better person, how can you be there for others? And that's a big motivation for people.
So like, I totally hear what you're saying, but can you just like tell us, like give us an example of something that an actionable step a dentist can take today to kind of reframe how their day is going? Because we all know, like, I don't know about you, but the reason I sedate people is not for the patient, it's for me. So I can feel more comfortable doing the procedure. You nailed it perfectly. Like we work on fearful patients, and I know the patient's freaked out, but I'm even more freaked out. And you mentioned the blood pressure. I'm a healthy guy. I run 10K a day. I'm not worried about my health, but why do I have high blood pressure?
Yeah, no, that's exactly right.
It's legit. What can we do when, like, every day to help reframe how the day's going?
You're talking about reframe, like you're having a bad day, you want to make it a better day?
Yeah, like the typical clinical day, we hear we may need to do a revision, or someone has pain with a filling, or an extraction site still hurts. What's an actionable step a dentist can take?
One of the biggest changes you can make is by finding your purpose outside of dentistry. And this will cascade into every decision and priority that you make in your daily practice. So when I was in my dark side of dentistry, my priority and my purpose in life was to be the best dentist in the world. And when that is your priority, then you come second, and the patient comes first, and your team comes first, and the procedure comes first. But once you've put dentistry in its place and you've said, you're what I do, you're my profession, I can love you, I can be passionate about you, but you're not who I am, then everything falls into place. So if you have that revision and you've made sure that your purpose in life isn't to be the best dentist in the world, your purpose in life is to help others, or to be the best mother or father in the world, or to be the best neighbor, or to, help sick kids, or to clean the environment, or something like this, then that revision is just a part of your daily practice.
Yeah.
And also, if you have prepared the patient for that revision and you set true expectations, they don't come back angry. They come back expecting it. So you have to underpromise and overdeliver. So there's like a full system in how you talk to patients, how you think of it. Now, as just a very actionable item, it's also breathing techniques that can really massively decrease anxiety in 5 minutes or less. Doing something like box breathing, where this is something that the Navy SEALs use, where you inhale for five counts, hold it for 5 counts, exhale for 5 counts, hold it for 5 counts. You've probably heard about this on a lot of podcasts and whatnot, but research backed, true stuff where, us as medical doctors, we know the body, we understand the body, and especially you, if you're doing sedation like I do, is we have with our breath, it is an autonomic aspect of our body that we can control, right? It's kind of weird. It's like we can't control our blood pressure directly. We can't control our heart rate directly, but we can control our breath, which then controls our blood pressure and our heart rate, right? You've seen it when a patient is going apneic, right?
Yeah.
And what happens to the heart rate?
Yeah, it starts going up big time. Yeah.
Changes, right? So so that's something that I do all the time now. Even when I'm like frustrated when I'm driving and there's traffic, I'm just like doing box breathing.
That's a great point, man. It's so important to remember that, because I find a lot of dentists, just like patients, we end up holding our breath as well when patients are nervous. And I think I need to remind myself, when patients are upset at us, my blood pressure is going through the roof, my heart rate jumps up, and I stop breathing. And you're absolutely right. When patients are on nitrous, I teach them, hey, this is what box breathing is. You breathe in for 5 and it works so much better. And dentists should be doing that too. That's a great point, Kyle.
Yeah. There's a lot of dentists that mouth breathe through their masks. There's dentists that grind their teeth while they're doing, I used to do this while I was doing extractions. I would I got the cow horn in there.
Patients love calling it a cow horn too. Grab me the cow horn.
When you think about teaching, sort of mental health tips and tricks, I'm just astonished by your ambition in the space, because I get so discouraged anytime I think about it, because I've been in therapy for 4 years now. And, only in the 3rd year was I like, I did that differently than I did that in year 1. Right. And it takes so long and it's so frustrating. And you've shown your virginity card when, in mental health, when you can go to when you're kind of talking to someone about mental health and they're like, just fix me, like, tell me the trick, tell me what to do. But it's like, it's just so amazing to me that you went out on this mission to cure mental health, obviously knowing that it's so difficult and so challenging. So when you started it, what did you set as your goal? Like, it's such a hard thing to even grasp,
Yeah. My initial goal was just, I don't want any dentist to go through what I went through. And then it turned into like, I wanted to decrease suicide rates in our profession. And then it really went further. And now really my goal is to decrease suffering for the families of dentists, because you see how families suffer when their mom or dad or uncle or grandma or grandpa, isn't really in the right frame of mind, or isn't there on Saturdays because they're, taking patients on the weekends when they don't really need to. They feel like they need to, but they don't really need to. And so I really wanted to stop the suffering that happens from children and spouses and loved ones of the dentist. That's really my ultimate goal, is I want to help the dentists so that the family doesn't have to deal with what the dentist goes through.
But Kyle, I feel like that's so easy to say though, because we're trying to build our practices. We have patients that almost demand us to come in for, you know, something. My tooth hurts. You're my dentist. It's Saturday night at 7 p.m. You didn't call me Wednesday at 3. You called me Saturday at 7, and we're expected to jump because we're here to build our practices. This is hustle culture. Do you know what I mean? How do we? What do you say to those dentists? How do you? You can't just say don't go. Absolutely, we all are. Yeah.
Sure, I bent over backwards. I did anything. I came in on Saturdays or Sundays, or, you know, when my wife and I had a date plan, or it was my kid's soccer game or something, I did all of that. It's so easy to say no when you have your priorities set. When you have your purpose in life and you have your priorities set, it makes it very easy to say no. And you know what I found? I expected that when I said no to patients, they would hate me, they'd write negative reviews. When you come down from being this like all-knowing doctor, dentist, to just being a human, and you couldn't connect to them on a human level, they respect it. So like, you know, there would be times when a patient will be leaving and they're saying, oh yeah, doc, like, I know you guys are open till 5, but like, could you see me on 6 next week at 6 next week? And if I say like, no, I coach my son's baseball team and they practice at 6, so I can't.
Yeah.
They don't say like, I can't believe you. They say, oh, okay, cool. Yeah, I'll find a way to come in. You know, I'll take off work, or I'll get a sitter or whatever. They respect you. I think sometimes patients forget that we're humans behind us, behind the white coat. It was why I posted that recently, like dentists have feelings too. They forget that we're not these dental robots. And you think when you become vulnerable that you give up your power, and it's total opposite. You become powerful when you're vulnerable. It's like when I talk to patients about complications. I used to be so afraid to talk to patients about complications. And now, let's say I'm placing an implant. I'm like, you know, implants are great. They tend to work, but 5% of the time they still fail. And this may be you. You're going to have to pay for it again if it fails. I don't know how long it's going to last. It may fall out before you get to the elevator.
Yeah.
And that sets them up. If that's the patient that goes, okay, sounds good, doc, I understand. You know, most of the time they work. If they don't, and then we got to do it again. That's the patient for me.
Yeah.
And I realized that I didn't have to take everybody. I originally thought like every patient that walked in my door, I had a treat. Not the case. And you'll lose money. Your business will go down on these patients you think you have to take. It's like the emergency patient, right? If you can't see them, you say, you know, I'm in Monday morning at 8. I can see you Monday morning. Or if not, call the endodontist. Maybe the endodontist will see you.
Yeah. Do you feel like that comes from, like, I feel like a lot of dentists have this inherent ability to want to be liked. And
oh, for sure.
And
for sure.
We can't get around that. And I find until a dentist has been out for that 15, 18-year mark, you give it up. But your first 10, 12 years of practice, you are there every day. I will help you because I'm your man. I'm your person. I'm your dentist. What Definitely. Is it? Why is it? How did that come to be?
Yeah, this is a big problem. And it's something that I've seen in our support groups, our mastermind groups. I suffered from it. I still suffer from it. I hate to keep harping on the same thing, but when you figured out what your purpose in life is outside of dentistry, that changes as well. And you set priorities that aren't necessarily the best thing, or aren't necessarily the best thing for the patient. You know, like I'm talking about you're going to give them poor care or something, but scheduling and whatnot. Yeah. I think we also have to get over ourselves a little bit. I was very much an ego-driven dentist. I loved being called a dentist. I love my friends being like, this is Kyle, he's a dentist. Like, I loved that. You know, I wanted my tombstone to say Kyle the dentist, or Dr. Stanley. Even.
It's our identity. It's all we have.
It is our identity.
Yeah.
Yeah. And when you separate yourself from, again, it consumes you. And if you can separate it, put it in its place, then you start making better decisions. You start being like, I don't care if this patient goes somewhere else. I don't need them. There's plenty of patients in the world, you know. Even in my practice, okay, we have 52 dentists in my building, not in my state or in my county or my city. In my building, there's 52 dentists, and we're the most expensive. And so, you know, they could literally walk 10 feet and go to another dentist. There's plenty of people. There's plenty of patients. And those patients that you think you have to bend over backwards for, many times they ruin the morale in your practice. Team members leave because of them. You know, you're late for other people that are there, that are paying, that are willing, that are happy, that, you know, take a palatal injection and don't move at all. Like, those are the patients that we want to treat. We think we many times behave like we work in hospitals, and we have private practices. I mean, that's one of the best things about being a dentist, is that you have a private practice, you have a private business most of the time, you know, unless you're hospital based. I mean, that's also one of the most difficult things with it.
Yeah.
That you have to run the business too.
How much of this problem do you think is caused by dentistry versus inherited because of the selection process?
So you're saying, like, are the applicants that are coming into dentistry coming in with these specific personality types and feelings? Is that what you're saying?
Well, yeah, because in order to get into dental school, you need like a 4.0, you need to be Mother Teresa in terms of volunteering in every single community. So like, do you think it's the profession shapes people to have these sort of character traits, or do you think it's something that people come in with just based on the
so it's a little
criteria?
bit of both. I have a diagram called the dental path to depression, and what it starts out with is many of us come in with this, I won't say anal, I'll say detail-oriented way of thinking, right? We measure in tenths of a millimeter, microns even. Now, if you don't come into dental school with that ideology, that gets like crammed into you. Absolutely. So you leave dental school, you are very detail-oriented, anal, measuring tenths of a millimeters or microns. You mix that with the stress that happens with dentistry, like we talked about, living in an environment of fear, increased blood pressure, patients telling you they hate you, not wanting to pay, showing up late, dealing with team members. That leads to burnout. And burnout, one of the definitions of burnout is dealing extensively with other human beings that are troubled or having problems, which is kind of like the definition of dentistry, right? So you have people coming in that are detail-oriented. If you're not, that turns into you are detail-oriented in dental school. Then you have the stress of practice once you get out of school. That leads to burnout. Burnout is highly associated with depression, and depression is highly associated with suicide. So I think that it's a little bit of both. Many of us come in with a certain personality type, but if not, it's put into you. You have to be detail-oriented to be a successful dentist. We also have the overachiever complex. I mean, this is something I talk about in my courses. Like you said, you come into dental school, you've never failed before.
Yeah.
You've done well in high school, you did well in college, you did well in dental school to pass, you had to do well on your boards to get into residency or whatever. So the first time you fail is when that lower molar, crown falls off. And now you're 26, 27. You've never failed. You've always been the highest achiever in your life, in your family, in your friends group. And all of a sudden you say, I've spent 10 years of my life getting to this point. Like, maybe this isn't right for me. Am I not good? Something wrong with me? Was I not trained well? And so we do this really deep dive after that. You get on this peak of Mount Stupid where you think you know everything, and you dive very quick to this valley of despair. And that's what I've seen time and time again with doctors. And that was what it was with me too.
As someone that was a practicing dentist, you're in AI, you're a successful business person, you coach on mental health. What do you see as the biggest problem facing our profession?
Ooh, I mean, I'd probably say mental health is the biggest problem. Yeah, I would say mental health is the biggest problem. From a clinical side, I would say predictable dentistry is the biggest problem. But for sure, mental health.
I totally hear that. Do you feel that social media and this whole Instagram hype of every dentist out there wanting to prove their cases, these flexes, everyone's trying to show how great their pictures are, I feel like that is destroying people's mental health just as quickly as patients are?
Yeah, that's one of the triggers actually that I talk about in the course is professional jealousy. Before, like my dad told me, you never really knew the dentist down the street. You never really knew their work unless the patient came into your practice. But now, not only do you see what you think is their work, you see their highlight reel.
Yeah.
All you see is everything they've done well. Every time the single shade, single anterior matches perfectly, or when the papilla comes back in between that implant, or when you have the immediate loading and it doesn't blow up, or when the sinus doesn't blow up, you never see that.
Yeah.
You see every time they do something well. I understand where that's coming from, right? Especially if you have patients that are looking at you and you don't want to show complications. But I found the real true educators, the people that are real, those are the people that we need to keep as like our idols in dentistry. Like I always say, Dr. Joe Kahn, he's like such an amazing educator because every time he talks, he shows failures. This is what it looked like 10 years ago. I published it. I took it around the world. I lectured on it. This is what it looks like now. And, the implant is coming out. There's pus everywhere. The patient's pissed off. Like, that's real dentistry. That's how you really help people.
I'd
So
add
there's
Neki to that list. Necky's whole presentation. Necky teaches on extractions. His whole presentation is just all his screw ups.
Yeah, that's how you learn.
That's the only way to learn. And that's the only way to like talk to someone face to face and let them know we're on the same level. Your patients are not different than mine. They all have failures. And I just wish more educators took that approach because in my opinion, seeing all these highlight reels on Instagram kills me because I'm like, I can never do that.
And what I found was when you talk to patients like that as well, they respect you more. I thought when I started talking about complications, patients, first of all, wouldn't do any treatment with me. They wouldn't refer anybody. And it was the opposite. They connected more with me because they connected like, oh, he's imperfect. He's like a human. And all they really care about is that if there's a problem, you'll know how to fix it.
Yeah.
And so when you connect on that level, then they really trust you. They start referring more. The case acceptance goes up. So it was really backwards from what I thought it would be like.
Yeah, I found in the last couple of years, and I teach this as well. The thing that has really helped me is patients do much better with explanations than they do with excuses. Because the second you say, like a patient comes back with paresthesia, you took out their wisdom tooth and they're numb lip, and they didn't know that was one of the risks, you're in trouble. This is you need to give them that's the excuse. Well, the nerve was right there.
Yeah.
Like, and you didn't tell me. Like, you have to give them the explanation of every single complication that can happen from your surgery. And you're totally right, because then patients aren't against you. They want to work with you and they want to help resolve the complication. So I 100% agree that all dentists should be searching for, the way to talk to their patients. They should be taking communication courses, not more clinical courses, because you nailed it right there. If you want to get rid of some of the triggers on your list, it's all about communication. And I'm so happy that there's, finally someone on the stage like you willing to teach it to the masses.
Yeah. One thing we teach in our Light Side Live course is crucial conversations, how to have crucial conversations with your patient, with your team members, with your neighbors, with your spouse, whoever. It's such an important topic that we're never taught. And, going back to what you were saying about talking to patients about complications, I think what's really undervalued is, let's say you have the complication, right? Let's give the first example where you didn't talk to the patient about it. The phone call goes like this.
Yeah.
Hey, this is Sarah. I just had my tooth extracted. I can't feel my lip. I think Dr. Stanley screwed up. Like, I don't know what he's doing. He looked kind of young. Like, I don't think he knows what he's doing. I need to come in and see him right now. Okay. Then your front office is like, oh shit. Okay, Sarah's back. She's pissed off. She comes to get you. You're in the middle of like a 10-unit veneer case or something. Hey, Dr. Stanley, Sarah's on the phone. She's not too excited. She had lips kind of thing. Can you see her? And then all the teams like, oh crap, Sarah, we hated her. Oh no. They're all pissed off. They're worried she's coming back in. Now, you talked to Sarah. You told her that this is probably going to happen. And if it does, not a big deal, but I'd still like to see you. The phone call goes like this. Hey, this is Sarah. I got my tooth extracted a few days ago. Yeah, Dr. Stanley had said that my lip may be kind of numb. And, I think that's what's happening. Can you find a time when he can see me?
Yeah.
Completely different outcome, right? The entire morale of the practice has changed. And how the morale of the practice impacts your mental health is huge. And nobody's talking about this. So completely agree with you.
I think we've gotten a good idea, sort of a state of the union on dentistry. But I mean, this podcast is about you. What are you working on from a mental health perspective that's taking the most amount of your time?
Yeah, so my Lightside Academy is really my signature course that, again, we've had hundreds of doctors go through. It's been my life's work, I would say, in getting this out, because I don't know another mental health course that exists in dentistry.
I don't think there is one. Tell us how that works. Like, how does the actual course work?
Yeah, so it's an online course with pre-recorded videos, and then there's also action tasks that go along with a workbook. So it has the research in there. There's action tasks on how you can define things like your purpose and look at what your legacy is. And we talk about daily habits and how you can change that. I'm a research nerd, so everything is in there as far as the research. And then from there, we have a lot of our Lightsiders that want more. They're like, I did this. I want to feel accountable. You were talking about accountability partners and whatnot. So many of them go into our bi-monthly called a mastermind group, but really it's a support group. It's a bunch of dentists sitting around talking, complaining, getting ideas on how do I handle this case? How do I talk to this patient? How do I talk to this team member? Hiring and firing. My hygienist comes in late every day. What should we do? And really just a way to feel heard and feel understood. So that's a Zoom meeting. We meet twice a month. And then we also have our Lightside Live courses, which is with myself and Dr. Martin Mendelson, who is resident faculty at Spear Education. And he has his certificates in happiness studies and works with teams. And we do a 2-day course, which is like our Lightside Academy, but live, and then adding all of Martin's stuff. And it's just been so rewarding to be involved with this. I'm also writing articles on mental health, just trying to get this out of here, scientific journals, and things like Dentistry Today and whatnot. So yeah, I'm busy.
So Kyle, why do you teach? Like, where did this, you like before we even went on this conversation, I told you I saw you speak, I think it was 2012, 2013 in LA at an implant academy, and you were narrating a surgery. And I'm like, man, that guy's so cool. I want to be him one day. And that was, I don't know, 10 years ago now. Like, why did you get into teaching?
I love teaching. It's a way of breaking up the clinical days of dentistry for sure. But I feel a little limited treating one patient at a time. I feel like I can't help that many people. When I teach, I can help many doctors and they can help their patients. And it's the same way like doing mental health. I can, or even doing what we do with Pearl, with AI, is like, I can kind of scale myself. And I wanted to be able to help more than one patient at a time. I just love interacting with colleagues as well. We have a special bond with dentistry.
Yeah.
It's something that no one else will understand. But it's just like any other profession, right? If I went to people that were in the military, they have a special bond that I will never fully understand, And when you get out and you're with your colleagues and you're talking shop and you exchanging ideas, something so special about that. I really get in the flow state. And whenever I can do something where I get into the flow state, I'm going to do more of it. So teaching has been a real big passion of mine.
Do you think that's why a lot of people, like when you were saying this special bond, people maybe don't understand what dentists go through? Do you think that's one of the leading causes of why dentists get divorced? Like this high rate of dentists having failed relationships?
Yeah, so there's some research on that. We actually don't get divorced any more than the average person, but we still have a high divorce rate because the average divorce rate is high.
Oh, okay.
So
maybe this goes for everyone then.
yeah. But you add on relationship challenges to what we're already having problems with. That is difficult.
Oh, totally.
That is difficult because going through a relationship problem is hard anyways. But then let's say you have a patient that's threatening to sue you and you're getting a divorce or, something like this. I mean, it's just really, really compounding. But I would think dentists are hard to be married to.
Yep.
You know, we're detail oriented. We love our work. We work a lot. I think the dentists that I've worked with that have really changed their mindset, they have the daily habits, they become better spouses, they become better parents by putting dentistry in its place.
You're obviously a really introspective guy. And I feel like whenever I talk to introspective people, they always have like a northern star or like sort of guiding principles that they're always working towards. Like in this season of my life, mine is like a quote, which is shame doesn't exist in the light. And it's all about vulnerability and opening yourself up. Do you have any of those sort of things that stick out in your mind that you sort of use as a compass or a North Star?
Well, I think I said a little bit earlier, for me now, it's reducing suffering for the families of dentists. It's fairly simple. And I can do that through my mental health work, through my, AI work with Pearl, through teaching. So that's my guiding star from a professional standpoint.
How about personally?
From a personal standpoint is just to be the best father and husband and neighbor that I can be, to really be a giver and leave a good legacy. I don't want my legacy to be like Kyle was a great dentist. I want it to be like, wow, he really gave all he could to his family and his community and his tribe and whatnot.
How do you measure that,
Hey,
though?
Cal. Yeah, that's exactly what I was
How
going
do you
to
what?
say.
How do you measure
How do
that?
you measure?
I don't know. That's a good question. I don't know if I can measure that. And maybe it doesn't matter as long as I'm trying. I think it maybe isn't measured until I'm dead.
Yeah.
I don't know. Like I think about my grandparents. We talk about them all the time, and some of them have been dead for 20 years. We never mention their profession. We mention like, oh, remember when Grandpa would get on the ground and play trains with us at his house? We weren't like, oh, Grandpa was such an amazing steel worker. No, we don't even mention it. That's true legacy.
You have a really good point there, because I find there's no other career out there that dentists, like, we hold it close to our hearts. My name is Neki. I am a dentist, but I also like running.
Right.
It's this passion
Comes first.
Yeah, but we're all passionate. We go to work, we finish the day at 6, we go do charts, go home, get some food, and then we're on Facebook and Instagram learning from other dentists. We're on demand, whatever courses. On weekends, we're flying to Florida, not to go to the beach, but to go to, the latest symposium. How do you, like, dentists are very passionate people. How do you try to incorporate this, like, hey dude, you need to chill out and you need to redefine what your purpose is, because it's become our identity, and it's almost like a self-serving, disaster coming at the end. How do you reframe that for dentists? Because I feel like it is so important, and you really nailed in on this niche here.
You have to separate yourself from your profession. You have to realize you don't have to lose the passion. I'm one of the most passionate people ever about dentistry. I love implants and smile design and minimally invasive preps and immediate dentin sealing and sinus lifts. I love it all, but it's my job. It's not who I am. And once you make that change where you say, I can love it, I can be passionate about it, but it sits over here. And when I leave the practice, I'm not a dentist anymore. When I'm at home, I'm just dad, or I'm just Kyle.
Yeah.
When you make that change, your entire life changes. Because it's not like I don't go to courses, and it's not like I don't look at things on Instagram and whatnot, but I don't let it take over who I am. And it did before. And that was what caused this downfall with me.
The interesting part here is I've been a dentist for 15 years. Akil is in dental school. A lot of people that listen to this podcast are younger dentists or dental students. And Cal, you've kind of lived through the different stages of dentistry, and now you're trying to warn everyone about that. What are you going to say to the 4th year dental students graduating this month ready to dive into private practice and almost ready to start that cycle of this dentist going downhill?
Yeah, I would, again, I kind of sound like a broken record, but you can be passionate about it, you can love it, but it's not who you are. And it's easier to grind and to work late hours and do this stuff when you're single, when you're not married, when you don't have kids, because that's what I did. And I actually was fine doing that. But it was when I had the bigger purposes in life for me that it wasn't sustainable. Because when you talk about success in dentistry, you talk about sustainable success in dentistry. It's very easy to have success in dentistry.
Yeah.
You work a little hard, you get a good job, you make good money, you do some good cases. But doing those good cases day in and day out, doing it for 20 years, doing it and having a successful marriage and having good friends and being healthy and exercising and eating right and drinking enough water and meditating and sleeping, and that's difficult.
It is.
And so the sustainable success is what you have to look at. So even if you're doing something, you're working your ass off. Can you do that for 5 years? Can you do that for 10 years? Can you do that for 20 years? Probably not.
I'll tell you an award.
You see that in residency, especially like in oral surgery residencies. They work their ass off, and it can happen. You can do it for a few years maybe, but even some residents burn out in residency.
Totally. But
it's not sustainable.
Dentistry is one of those professions I find sort of like medicine, where obviously hustle culture is a thing, but it's also closer to medicine in that it almost, from the outside, it feels like people are, pressuring you to make it your life. I feel like I got awarded for 2 years in a row least likely to graduate dental school because I have all these hobbies and I spend all my time doing that, and I could spend more time studying. But it comes with a little bit of shame too, where people are like, you're treating patients, you should be taking this more seriously. And I do take it seriously, but it's just that, sort of that voice that kind of trickles back to me that I hear, oh, that person said that, this person said that. Why is that the case in our profession?
I think it's because it takes so long to do what we do. I think if our profession was something that you did in a year, it doesn't get crammed into you. It doesn't become who you are. But that's why it happens in medicine too, is that it takes so long. You had to really kind of start thinking about this in high school, right? At least, in North America. You had to think, I maybe want to do something with medicine, so I need to do well. And then in college, you have to take specific courses, right? And you have to take the DAT or whatever it is. You've been doing this for like 8, 10, 15 years just to get to the point of where, okay, now you are this person. And so I think it's because it takes so long. And I've had this conversation with a lot of people, and that's what a lot of people say is because it's just everything that you live for your entire life for so many years, it takes over who you are.
I feel like I've become a better mental health. I don't know what the right word is. I feel like I've really grown a little bit in the last hour here, and you've nailed something to me, and it was redefining my purpose. And actually maybe trying to figure out what my actual purpose is, because it's not going to work every day and pulling another wisdom tooth or talking someone off the proverbial ledge of, is this going to hurt? I really feel like you're onto something there. If people want to take your course, where do they find it?
Yeah, so they can message me directly, or you can go to lightsidedentistry.com. That has all of my online courses, my in-person courses, and that's the best place to find it.
That's awesome. I really look forward to taking that course and telling all the dentists around me that it's not just implant courses you need to take, it's mental health courses, because that will ensure a longer career. Dr. Kyle Stanley, thank you so much for coming on our show. And I hope to meet you in person once again one day.
Yeah, I hope so. That'd be good. Let's make it happen.
Thanks so much, Kyle. Appreciate it.
Thank you.
Welcome to the Hi, I'm Neki. Is that a sweater?
Yeah, dude, it's the Hi, I'm Doctor sweater. Oh, dude, I see you got yours on too. Looking sharp, bro.
Dude, where'd you get yours from?
It was super easy, man. I just went on to our website, www.hiimdoctor.com. That's HIIMDR.com.
We have a website. We must be raking in cash from selling these sweaters.
Dude, we are killing it. I mean, if that includes losing money on every single sweater that we make, I think we're doing really well.
Yeah, Neki and I are donating all proceeds, which is zero, to charity because we are losing money.
I wonder if the charity will pay us. I think we got something here, man. Let's keep on keep on losing money on every sweater.
Alrighty, guys, go check us out. hiimdoctor.com.
Let's see it.
Neki, what's one thing you're working on for your own mental health right now?
Man, I don't know. What am I working on? Honestly, I feel these last couple of years have totally changed in my own head. I used to compare myself a ton to other dentists, and you talk to dentists and they have like, 10 practices, they live in $1 million houses and they drive this and they go vacation here. And I just wasn't doing that. And then I realized I don't want to do that. And comparison is the thief of joy. And I truly believe that because I was always looking in my neighbors' yards thinking, why is their grass greener than mine? And then I forget to water my own grass, and life just is never fulfilling for me. And then when I stopped caring necessarily as much, what they're doing and start focusing on me and what makes me happy, like jumping on a pod with you makes me so much happier than burying my head in a book or seeing 10 more patients or trying to work on anything to do with the practice. Like, do what makes you happy. And at the end of the day, that's what you're going to remember. It's not how many more patients you saw or more you did at work. It's what you do outside work that makes you so much happier.
That's so true. Yeah, like aligning your priorities with what you actually do in a day.
Totally.
Sort of thing.
And like that's what Kyle was saying. He was like, find your purpose, because right now, everyone listening to this podcast, their purpose is to be the best dentist they can be. And to, it's kind of funny. The name of this podcast is Hi, I'm Doctor. And Kyle's trying to say, no, like that is, no, it's not Hi, I'm Doctor. It's Hi, I'm Neki. What's up? Can we rename the podcast? Hi, I'm Neki and Nikhil.
So we had this conversation literally last night, did we not? About how, like we were talking about how we took this long hiatus from my final exams.
Oh yeah.
And you felt like
Yeah,
a part of you was missing.
Man. Totally. I was like, where's my homie Akil at, man? I just I feel like just talking to people within our profession, and it's not clinical. I love it because we're all just human at the end of the day. And the thing that connects us is our love for dentistry, but we don't have to be identified by that. And I hear it all the time. Whenever I go out is, hey, there's Neki the dentist, or I'll see family and they'll say Neki the dentist. Hey, look at my tooth. And I'm just so tired of it. Then people are like, hey, I go to toothache, haha. And I'm like, not funny, man, because I don't care anymore. Like, I don't want that to be me. You know what I mean? Like, almost like one day I want to say, okay, I'm done with dentistry. I'm going to become a politician, wear nice suits every day. And I just want to take on another career, just so I can prove to myself I just don't have to be a dentist.
Yeah, it's true. It's true. It's one of those all-consuming professions where you can't half-ass it because you're dealing with people.
And there's no days off. Like, you can't have a day off. You have a day off, your patient has complications. And that's stressful because there's so many other, careers out there. Oh, I'm having a bad day, I'm just going to go home. No, you can't do that. You're having a bad day, you take out that tooth incorrectly, like a patient has problems, there's no days off. You always have to be on. And I agree, dentists are incredibly passionate people, but patients shit on us on a daily, hourly basis. Is like, it gets to all of us. Like, you know, when someone tells you how much they hate coming to see you, and you just have to smile and take it, and you're like, okay, well, this is going to be great, you know?
Can you elaborate on that? Because I've never practiced a day in my life. So what does that mean? Like people
So
come in and tell you,
in initially, like when I was a brand new dentist, people would like come in, they're in your chair, and they'll be like, oh, I hate dentists, I hate you. And then they always qualify it by saying, well, not you personally, just your job, as if it's not no longer an insult. And so what I
no
started
offense.
saying, yeah, but like after 15 years or 12 years, I was like, I hate you too. And then it
No
almost
offense.
like, but it puts them in their, and they like almost take a step back and be like, that's not very nice, is it? And you almost have to say that, because we're people too. And then they'll always say, well, I don't mean you. And I'm like, well, you know, I know you don't like this, and I don't like having to do this for you, but I'm trying to help you. And it almost like reframes it. And I just find I'm sure that there's a more eloquent way to put that, but patients need to understand, I'm not doing this for my benefit. Like by taking out your painful tooth, you realize I'm trying to help you. And by you saying how much you hate me to begin isn't really helpful.
Yeah. Isn't that just yeah, it's just like one of those things that it's almost like people will start to believe it. It's like, huh, I kind of hate me too. And
Yeah.
it's tough because you say that, and as someone who's training to be a dentist, my mind immediately goes to, like, again, this is just completely candid here, is yeah, but you live a good life. You're not like a janitor. You make good money. You sort of have like a 9 to 5. You have a team that supports you. And it's so shitty in dentistry, or like any position where you're in a place of privilege, you kind of lose the license to complain about it.
That's a very good point. You're 100% right, because people, they think they see money, they don't see all the bills that come out. I have a staff. It was funny. I was asked, my office manager was like, "Hey, Neki, how many people do you have working at this practice?" In my head, it's always been 32, and she was like, "Neki, it was 32 4 years ago. It's actually 41." And I was like, "There's 41 people working here?" And she's like, "Yeah." I was like, oh. And then it just built on this house of cards that can crumble down at any second. And I feel the dentist's job is to balance this house of cards and support it every day. Because when that patient comes in and may need a revision, or in reality we call it a failure, right? And they're angry, they're upset, we're just trying to support this other side of the deck of cards. And then you have a angry staff member, now we're over here trying to do that. And it's always this delicate balance of just trying to make it through the day. And one of my partners at work, Reagan, she is such a great dentist, and she's been practicing for 16 years. And I'm like I can see it in her already, that she doesn't sleep well at night anymore, and she's always worried about patients, and she feels like she needs to escape. And I totally resonate with that. And I think everyone out there resonates with that too, because this job is grueling. It is so grueling, man. And people think, oh, we make a lot of money and we drive a nice car, but you wonder if it's even worth it, because it is so mentally grueling. I don't know how else to explain it, but I can't complain either, because what am I? I'm sitting in a warm house right now. I have food in my fridge. I'm going to go on vacation eventually, like how bad can it be? But mentally it's tough for sure.
You're right. And that's not the perspective that most young people who are getting into dentistry have. And I think you made that point on the pod, which is people go into dentistry thinking they want the nice car, the nice house, the nice
Yeah.
lifestyle, the 9 to 5. And probably part of the reason why they end up getting so burnt out is because they don't get what they expected, right? It's like, this is not what I bargained for,
No.
because there's so much other baggage attached to it.
Oh, totally, man. It's if we're not comparing ourselves to each other, it's, you go on social media and you get it from strangers and you're like, I can't do what they do. and it's people flexing their highlight reel. And that's what I was kind of talking about on the pod is I think that's killing dentistry. It's killing dentists. On one hand, it's making dentists want to compete at this level of perfection. But then for the 99% out there, it's like, could I ever do that? Oh, I must not be that good of a dentist. I must not be that good of a person. And now it's a self-worth thing. And I think every dentist will go through that. And it happens at about, I want to say year 3, because the first 2 years, you feel like you graduate and you know everything. It's the Dunning-Kruger effect, right? Like you don't know what you don't know, right? You come out and you think you're a genius. You get smacked around eventually by year 3. You're like, oh shit, I actually don't know anything. And I need to actually learn all these courses. And then you see on Instagram and social media, like, oh, this is at what level it needs to be done. Then you continue to take courses. Oh, I'm not good enough. I'm not good enough. And then it's just downhill from there. So I don't know what the balance is. I wish I had the answer. And Kyle's really on the right track by trying to explain to everyone, like, maybe you need to redefine your purpose, because dentistry cannot be your purpose. I feel like I'm on these like Shakespeare soliloquies here, like just just soapboxing, but I don't
No, I
mean
think
to.
it's great because it shows you're passionate about it, right? Like you wouldn't do that if you're not passionate about it. But it's such a like listen, I've been racking my brain, racking my head, racking something. I've just been on this tip of trying to figure this out for dentists because I think again it's the cohort I most closely relate to. And there's just so many things that I think in my life now I've started to question. Like, well, someone once asked me that like we were having a chat about like entrepreneurship and who should become an entrepreneur and sort of what it takes to be an entrepreneur. And it's a very, specific set of skills you need. You need to be very comfortable with uncertainty. You need to be self-motivated. You need to be able to bring a team together. Like a lot of dentists are going to be entrepreneurs. And then I said something that just stuck with me for 3 or 4 days. And I said, it allows you to question everything. Because like I have an amazing team, right? At Sage. I tell them every single day, if it's not fun, we're not doing it. I know we have bills to pay, but at the end of the day, who says you have to come to a job just to make money? You can do things to have fun. Or, like I want to bring my dog to work. I'm going to bring my dog to work. Right? It's not like it sort of sounds entitled when I say it, but it's almost like whatever's conventional, I'm learning is usually wrong. So this whole concept of if you're a dentist, you must live, breathe, eat, and sleep dentistry. That's one thing that I've just looked at and I've just said, that's so wrong. Because yeah, listen, I don't spend as many hours in the laboratory as my, fellow colleague. I don't, obsess over every single detail of every single slide. But I would argue that the other things I do in my life, like run a team, come on this podcast with you, communicate with people, be a co-parent to my dog, like those are the things I think that make me happy and actually make me a better dentist than if I were to just sit in a chair and just practice drilling.
But do you know what the 99% of other dentists are saying to you right now?
What?
You got to see a patient on Monday. You got to be ready for that.
But what does that mean? Like, what do I have to be ready for?
You have to be ready for the case coming in. Are you going to be able to help that patient? Like they're saying, from a dentist point of view, yeah, you definitely have a better balance, but I need to be able to help and serve my patients. The reason I became a dentist. So why would a patient come see me who doesn't spend time in the lab or going to courses or like trying to be the best dentist possible? And that's where the hustle culture starts. And they're like, I'm going to be the best dentist I can be. And then they get down this rabbit hole. And you're right. Like you're on one end, there's a lot of dentists on the other end. It's about finding that balance though. because you have to be prepared to see that patient, and you can't just have that dentist life balance, because you're going to graduate. And I hate to say it, because I just told one of my associates this, is like, you don't know anything. You, with all due respect, you don't. And so when you graduate is when you start, and you have to take a ton of courses. And then unfortunately, that's where it starts to go downhill. It's because you're never going to be enough, because you are going to have to see that patient, and you need to know what to do. So it's just about finding a balance, man. I 100% hear what you're saying, but like, there has to be some sort of balance here.
But who am I living for? Am I living for that dentist that says, who are, like, if I think of like the rankings of how I prioritize people's opinion of me, the other dentist who says you got to see a patient in the morning is at the very bottom. You know who's way higher than that? The patient and me. And I think if I can satisfy those two and still put out work that I'm proud of, like, for example, one of my questions was, when I was getting into dental school, how did you prepare for this interview? You know what my answer was? I didn't say I didn't. I said, to be honest with you, I'm really exhausted. I'm jet lagged. My half brother just got married in India, so I had to fly to India for 48 hours. And how I prepared for this interview was talking to a bunch of people in India who I'd never met, and introduced myself and put myself in uncomfortable situations. When I said that, I knew for certain that that interviewer had just listened to 400 other candidates talking about their point proof explanation of how they prepared for their interview. I remember him just putting his pen down and just looking at me and kind of laughing. But it was true. But the point is that, like, okay, what are you focused on? Are you focused on, and again, this is kind of back to what Kyle said, like know your priorities. Is your priority to appease the dentist that says, hey, you have a patient on Monday? No, my priority, if I put them on a scale, is going to be, like, my priority of what my work is, the result of my work is way higher than what someone else is going to like shame me to do. And if that means I need to come on this podcast instead of spending an hour in clinic because I learn how to communicate every single podcast better, I'm going to do that, because that's going to result in a better outcome for the patient. Like, I think it's like very narrow sighted to be like, the more work you put in here is going to result in, a better patient experience. I don't know. I don't know if I
No, I think what
yeah.
you're trying to say is patience. If I was going to, distill what you're saying, patients don't necessarily know what you're doing in their mouths, but they know how you make them feel. And by understanding how to communicate better with the patients may lead to a better patient experience than necessarily the dentistry that you're doing. Because if you aren't able to communicate and work on that with the patient, you guys don't go anywhere. But on the other hand, what a lot of dentists say is, how do I know clinically that I'm doing the best for my patient without spending the hours in the lab? Do you know what I mean?
Yeah.
Like, I just think that there needs to be a balance. You need a balance,
yeah.
man. You're totally right, man.
You've got to have both. Like, you need to make sure you're not being negligent and incompetent.
Well, that's where I was going to say, man, dude, at least go in summer and like spend an hour in that lab. Okay. Work on your hands, comb your hair in the mirror or something like that. Work on your mirror skills.
I just don't want to do that for me. It's a perm. No, I'm kidding. No,
awesome,
no
man.
perms here. Please don't.
No, that was a good episode, man. I really liked, taking a step back and trying to understand the struggle that a lot of dentists go through. And I'm sure he has great tips. I was trying to get some tips out of him, but there was some great tips and breathing and finding that balance and redefining your purpose. I think that was huge, and I think more dentists need to do that for sure.
Yeah. Shall we cap it off there?
Let's cap it off there. Excited for the next one. We'll see everyone later.